Typically, we're going to acquire 3 sets of data. And they're all going to be located in the same slice location so that we can use one or more of these sets to be able to subtract out information from tissues that we're not interested in. The preliminary set is basically no contrast at all. And these are actually going to be what we use mainly for our subtraction of other tissues that may actually show up on our exams that we're not interested in. Then we'll actually do an arterial phase or a first pass circulation in which only the arteries are going to be visualized, followed by a venous phase for which only the veins will be visualized. Some of the slower flowing arteries may actually still be draining, but that's okay. Now, a lot of sites only do 2 phases, and that's perfectly fine. It just depends upon what you're after and what you're looking for. Some systems sites are automatically setting up for a 3-phase pass system. Basically, after the first pass, the gadolinium is going to dilute as it mixes with the blood. So you're not going to get the same enhancement the second time through the system. So we may actually not be able to see enough sufficient arterial information if you missed your first pass. I'm not sure if that's ever happened to any of you. It's a sad day, and unfortunately, I can tell you that I have had this happen to me on occasion. It is quite upsetting to have to explain to the patient and also to the radiologist that your timing was off and the vessels were not visualized. But we take our responsibilities where they lie, and we just get the patient to come back in for a repeat scan after the contrast has had time to adequately leave their system. This is just demonstrating the different phases. This is actually 6 passes where we're actually seeing the GAD come into the vessels. If you look at the actual image that is demonstrating with the red arrow, you're starting to see the renal arteries and a little bit of kidney blush. The one image C actually shows more contrast enhancement in the kidneys, and you can see we're actually starting to see the spleen. Now, the reason the image B is so good to note is that here is actually where we would actually want to demonstrate our renal vessels. We can also see our gastric and our splenic vessels in this particular timing for this exam. By the time we get all the enhancement of the kidneys in image C, we really have obscured the splenic artery totally. And so there's not as much diagnostic information there. So image B would make a great first pass arterial phase. If we continue to look at the images as the contrast continues to circulate, you can see how it washes out as it begins to dilute with the blood as it circulates throughout the body. And the blue arrow for venous is actually demonstrating the late phase venous structures, and you can see the IVC coming up the abdomen parallel to the descending aorta. These are also first pass arterial phases. A little bit more contrast enhancement in the kidneys, but not too much where we're not actually seeing the other vascular structures that need to be demonstrated. We have our renal arteries going out into the kidneys, and renal veins that are starting to circulate back in. We can also see our splenic artery. Now, typically you're interested in one or the other, so your centering is going to be different. This was actually centered for renals, hence they're right in the middle of the field of view. The image on the right-hand side of your screen is a pulmonary circulation. Hopefully you recognize that after completion of our cardiac studies that we've talked about. And you can see the pulmonary circulation very well. Now, if you notice that there are some artifacts in this particular image, and that's very common, again, with gadolinium boluses, as it does change the T1 times of the tissue significantly based on concentration. This is kind of like a ringing artifact that we're getting. It relates not only to the gadolinium concentrations, but also to the timing of the bolus as it goes through the vessels. Venous phase, hopefully you recognize the jugular veins draining the circulation down from the cranium. on the image on the left, and we have our renal veins demonstrated on the right-hand side of the image. Now, one of the things about the renal veins is the kidneys are not always in the same position from anterior to posterior, and therefore the vessels will also be slightly off. So you do have to do some rotational oblique reconstructions to demonstrate the left and the right renal arteries and renal veins. Now the bottom line is we're looking for a quality gadolinium enhanced image. That's our go-to point. So we have to have an adequate amount of gadolinium enhancement or concentration for T1 shortening to occur. And think about the volume of blood that this gadolinium is going to be mixing with, especially as it hits the larger vessels and the chambers of the heart, where there is this huge inpouring of blood pooling. We have a couple of considerations to take into account. One, it would be our patient's cardiac output, how healthy their little heart is functioning and pumping blood in and out, and how we're going to relate that to scan time. If our scan time is too short, we're going to have scanning time problems, and if our scan time is too long, we're going to have some serious problems as everything is going to be enhanced. So we kind of have to hit that perfect time mark. So there's many ways that vendors have come up with for us to do this as technologists. We're basically going to try to scan at a time to catch the arterial phase and not include any of the venous. So we're looking at the circulation time, which is the time between the injection and the arterial enhancement. And this varies greatly from patient to patient. The average is 8 to 10 seconds for a healthy patient, and it could be up to 50 to 60 seconds in a patient with poor cardiac output. Now, remember I said we were going to try to do breath hold scans. Well, not exactly going to do that on a 50 to 60 second scan with a patient with poor cardiac output. So that's something to be considered too. Those are typically going to be the scans that are going to have more artifact on them. And our goal is to try to avoid artifacts. And so we have a real challenge that we're presented with. This is an example of how we set up the tracker bolus, our bolus tracking system. This particular exam is going to be for the renal arteries. You can see the finished project on the right hand side of your screen, beautiful renal anatomy. And also we can see this splenic artery going across there. And we can always see all the way down to the iliacs. We typically include this much of the anatomy in a renal exam. Then we go back and post-process and actually zoom in on the renal arteries themselves. Now, back to the slide at hand, this tracker volume we're talking about is going to be placed usually just inside the field of view. Some systems actually place them just outside the field of view, but this particular vendor goes in. And you can see that we have this tracker volume that's set up within the abdominal aorta. Just prior to the renal arteries origination. And so basically we're going to be sending in an RF pulse and tuning for that until we actually have the change in the T1 times that the system can obtain as it's going through this setup process. When it detects the bolus is reaching the volume of interest, then the scan will be triggered and the images will be completed. Beautiful process.